Hi, I'm Dr. Hoberman, and I'm here today to talk about Irritable Bowel Syndrome Month, which is April. This is a big issue, irritable bowel syndrome. It turns out that 15 to 20% of American population will struggle with this disorder sometime in their life. And it's not just having symptoms for a day or two of GI issues of bloating, gas, cramps, diarrhea, but it's when it starts lasting 6 weeks, 8 weeks, and becomes a chronic problem, and people's quality of life is really impacted, that it becomes a more serious issue. And so they'll come to our office or another office of physicians looking for a solution to their problem, and often they'll go through multiple tests to see if they can find an answer, and sometimes they do. But if there's no specific answer to their problems, then they're diagnosed with irritable bowel syndrome. And unfortunately, we don't have any good therapy for it. So it turns out we have 100 trillion bacteria in the GI tract. 80% are good guys. As long as they're in control, then everything stays in balance. But when we eat unhealthy, we travel, we get stressed, we take antibiotics, we disrupt this healthy balance, and the bad guys start growing. That activates the immune system that's in the gut. That leads to inflammation, and then you have the symptoms of bloating, gas, cramps, diarrhea, and you're miserable. So we developed a probiotic, which is the good bacteria that you need, and by taking them, you start to reestablish the healthy balance of the bacteria. That downregulates the immune system, and then you get rid of your symptoms and you become more normal. We learned that if you can rebalance the bacteria by using a probiotic, often you'll get alleviation of the symptoms. I developed EndoMune probiotic for that reason, and it turns out it's been very effective for people struggling with IBS.